Okay, everybody. First, thanks for coming. Gorgeous day in Northern Ohio. Well, like a really gorgeous day. I don't think I'd be here. I think I'd be out riding my motorcycle, but I still have one. Tonight, what we're going to talk about is we're going to talk about something that is so devastating to our environment today. We're going to talk about blood pressure challenges. And you may or may not know that my wife and I are writing a book about sex and romance, and what we have found that one of the leading causes of a lot of sexual issues is and are blood pressure medications. And what I'm going to talk about tonight is giving you the physiology of why you may in fact have a blood pressure problem. So let's talk about it. We're going to go right from the notes here. Blood pressure is the amount of resistance that the cardiac muscle must push against to move blood through the heart. Now what all that means is, watch me up here, okay? You have your heart. Your heart's a big muscle. Blood comes up this way on the right side of your body and it goes into your heart, which is located right here. So blood flows this way. So it goes into what we call your right atrium. Not that you need to write that down. It would be a test question at school. And then it goes down to the right ventricle and it goes into your lungs. And then it comes back into the left atrium, down to the left ventricle, out to the body. Now watch this, okay? Very dramatic. When your heart muscle pushes, okay, when it pushes, push the blood out, that's a part of the whole blood pressure issue that we have to deal with. And there's then how the blood flows back to the heart is how we find the diastolic blood pressure. Okay, so it's pressure. It's the magnitude of pressure that heart muscle has to peak to push the blood through the whole body. So what causes and what affects cardiac output in the body? Well, if you look at the one there I have written down, it's called peripheral resistance. Now let me tell you what that is. If you're overweight, they suggest that for every pound that you're overweight, it adds 200 miles of extra blood vessels. So if you have a weight issue in your body, the blood vessel is getting squeezed. Okay, that's resistance. So if you imagine your heart is pushing and pushing and pushing the blood, but if the blood is getting challenged because of an obesity problem, what's going to happen is that the heart is going to have to work harder. Something, and one of the, an item that any one of you could do to help lower your blood pressure is drink more water. Because a lot of people have thick blood. So the thickness of your blood affects the pressure. So everybody in this room should be drinking at least a minimum of a quart of water every day. A minimum. So that's not tea, that's not Pepsi, that's not Coke, that's not anything but water. And a lot of people say, well, I drink a lot of water. They only drink water when they take their pills. Okay? So what I want you to do is I want you to drink an adequate amount of water every day. The blood volume is the amount of actual blood inside of your body. And once again, we'll talk about it in a moment. If you eat a lot of sugar, sugar causes sodium retention, and sodium causes more water retention in your body. So let's go down to the third bullet. What did we learn from mummies? Now you can say, what do you mean, Dr. Bob, mummies? Well, they did studies on mummies in Egypt. And back in the good old days, when I was going to college, I used to teach human dissection. It's one of my favorite subjects. And I'm serious about that. When you open up people, you learn so much information. But what they did to mummies is that they opened up the mummies' bodies and they dissected blood vessels inside of them. And they found scar tissue in the blood vessels. So they came to the conclusion that the mummies, the Egyptians, had high blood pressure. And then what they did is they dissected, they opened up their stomach. Inside of their stomach there was grains and corn. They came to the conclusion that the mummies were eating, or the Egyptians were eating, the low-fat, high-carb diet, which we're going to talk about in a moment. Because a part of what is a leading cause of blood pressure, from my experience, happens to be carbohydrates. So let's go back to talk about the blood pressure itself. There's two numbers that I have down there, the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is like the 120 number, the 120 over. Now watch, look at me right here. Remember we were talking about how that heart muscle has to push hard to push the blood through the body? Well, that heart has to push really hard for whatever reason. You might be overweight, you might have a little bit too much adrenaline inside of your body from stress, and it works really hard The amount of pressure that it has to push against the blood vessels is the 120 number. You will stroke out if that number gets too high, 180, 200, 210, depending on how weak the blood vessels are in your body. But when the blood comes rushing back to the heart, so it comes rushing back, did you catch that? And it comes rushing back to the heart this way, the amount of squeeze going on that heart muscle is called the diastolic blood pressure. So let's say you have 180 over 110, your heart is working really, really hard. The diastolic blood pressure is the amount of pressure that comes back against the heart wall. That's really significant for you to realize that. So they have you believing today that 120 over 80 is not normal. They want people to get their blood pressure lower than that. I really believe in my heart a lot of that has to do with selling more medication. Okay, you just got to be aware of your own body. You have to be aware of stressors. I could have somebody come in our office the first time and their blood pressure could go sky high just because they're nervous. Now I have written down two elements there. You know, I'm always constantly reading. Well, there's a great book called The Ultimate Healing System by Dr. Donald Lepore, The Ultimate Healing System. And what Dr. Lepore, who was a naturopath, said, that you could help high blood pressure, the systolic, by adding sodium. You could help the diastolic blood pressure by adding potassium. Now, a lot of you will think, well, geez, Dr. Bob, you're going to get high blood pressure from eating too much sodium salt. And I understand what you're saying. I know that, and I've looked at different fast food nutrition facts, the magnitude of sodium that's in fast food is like, it's pitifully high. I would not eat fast food. But I encourage all of you that are listening to me right now to use Celtic sea salt, which has a natural balance of sodium and potassium. And if you have a blood pressure issue, there is a particular food group called alfalfa, which in our practice we use Mintran. Alfalfa has a natural balance of potassium and sodium. So if you have a blood pressure issue, you could try alfalfa tablets. You might have to take up to 9 a day. We use a product called Mintran. We've also had success, you'll see later on in the notes, using a product called kelp to lower blood pressure. Natural sources of sodium is salt. Natural sodium sources is celery and beets. Natural potassium would be cucumbers and carrots. And I eat those items myself every day with Celtic sea salt. I already talked a little bit about water amount. Dehydration. When your body is dehydrated, your blood pressure can go up. Everybody in this room should be consuming at least a minimum of a quart of water every day. I would watch the amount of sodium that you're consuming and our soda pop that you're consuming, and be aware how much caffeine. Now there is some research that says that caffeine does not cause your body to dehydrate. You know, I don't really drink caffeinated coffee. I drink half calf, half decaf that's organic. But if you're drinking a lot of soda pop coffee every day, you could have a blood pressure issue just because you're not drinking water. Stress. Stress is probably one of the most common causes of high blood pressure. I'll give you an example. I have a patient that works at one of the government agencies. He's an engineer. And he's thin, he's not overweight, he watches his diet. And a couple of years ago he came in the office, his blood pressure was up. And so I was asking him what was going on. He had a new project. That new project caused his blood pressure to go up because it was a stress that affected a gland in his body called the adrenal gland. Stress is devastating. So if you have a lot of stress in your life, okay, you may want to back off in some of your commitments. Okay, you might want to back off in some of your commitments because the stress can be devastating what it's doing to your body. Okay, let's talk about Syndrome X. Syndrome X. Syndrome X is high insulin. Here's what goes on with individuals. If you have a liver that's not functioning optimally, you're not secreting enough bile, you could have a layer of fat around the glucose in your body. So when your body has insulin, your body cannot even deal, the insulin can't even deal with the carbohydrates inside of your body. So your blood sugar is going to go up and your insulin is going to go up. When insulin goes up, your body's going to absorb and have more sodium, which means there's going to be more water retention inside of your body. So even your liver gallbladder mechanism can affect what's going on. So